My name is Matthew Nomm, and I was officially diagnosed with MS in 1985, officially meaning with MRI backup. Before I was actually told by my physician that I sought out because he was the one with the most experience in North America, Professor Swank of Portland, Oregon Health Sciences Center. He estimated that I had the MS ever since boyhood, somewhere between 7 and 10 years of age, according to his criteria of remitting and relapsing MS, only there was no diagnosis. And when we came to British Columbia, there was no coverage. So I never went to a doctor for a long time. My job was doing house calls and sleeping 3 hours a night and being a GP in Vermont. I was licensed as a Class 1 physician in the state of Vermont, and I moved from Vermont. I started getting some of the symptoms then, and I thought, well, too much stress. I was doing x-rays, I was doing this, I was going to the hospital. I'm retired, so I'm not practicing anything now, nor could I. I was determined I wasn't going to ever stop work, but basically what stopped me was the MS. When the patients finally said, gee, there's something wrong with you, I couldn't feel their veins anymore to put in needles. Yeah, and I found that when I was working with patients, I would push back all the symptoms that I was experiencing because I was more interested in what was happening with them. And there came a time when I just couldn't do that anymore. They would treat me symptomologically, treat the symptoms because there was no cure for MS. And the disease-modifying drugs like beta-seron, Avonex, Copaxone, all those that came on the market over a 10-year period, the statistics were, well, as the neurologist told me, the companies were a lot more optimistic than they were. I saw the TV program on W5 and thought, gee, that's kind of interesting. And then I came to North Van to ostensibly look after my 88-year-old mother, who's basically looking after me right now. And I went through the yellow pages and just to see, what was around, if I knew any of the physicians that I had known years ago, and ran across the Falls Creek Clinic ad that they had this unit, they had this, and I thought, well, a logical way to do is to see if I do have any abnormality in my venous structure. And so I had the Doppler done, and they had the MRV done, which you have to pay for yourself, and luckily, it's not that I had a lot of money, but I had sold a property that I had in Nova Scotia. And yeah, it showed that there was abnormality there. I knew what happens to drain blood from the brain to the venous system, and if there's any reflux or stoppage of the flow in any way, you're going to have the brain eventually immersed in waste products of metabolism. March the 24th to India, and I had the right side done, cleared with the balloon approach, and the left side, after many, many attempts, hours of trying virtually, they could not get into my left side at all. And as it turned out, later on the surgery that I had done, the vascular surgery on the left side, I had a graft transplant from a vein in my leg to the neck. is that I had a lesion inside there that was closing it off. I hope the vein in my leg was as better than the one that they removed. And no, the protocol is that after 6 months, you have to have another Doppler done anyway to see that there is flow there and the pressures are correct. In other words, it's not flowing upward, but it's flowing downward into your thoracic duct. My headache started getting not so bad. Just one area of the head would ache instead of the whole head. My vision started improving, although in the hospital there in India, I did have visual symptoms, but all those cleared up within a month. And the bladder was a big thing. I could go all night long, 8 hours, 9 hours, without having to, being woken up to go. And the bladder symptoms were all preceded by loss of bladder control some years ago, where I basically feel something warm down my legs, and that was that. Leg strength improved. I mean, my walking changed from asking my 88-year-old or mother to slow down so I can catch up with her, to basically, I think it was the day before yesterday, I felt like running. I hope it doesn't wear off. You know, and I think this is what everybody is thinking is, gee, if it was opened up and it can close down again, I'll be back in the same old boat. And I think everyone has that fear. I'm more optimistic that at least this side is a new piece. Knock on wood. I hope the one in my leg was okay. The first thing to find out is, you know, what your pattern of the vein structure is, and if there are actually any abnormalities there. Because my left side, that was completely plugged in the jugular, had grown collaterals, I think 3 collaterals that were taking some blood down. And he closed those off. He ligated those, put ligatures on those so more would go down the replacement vein. But I think the first step to find out is, do I have abnormal venous structure? And then, you know, take it from there. And hopefully there'll be more clinics around all over the place doing it. It's now that it's so new, it's taken everybody by surprise who already had a certain viewpoint of what AMS is. I haven't seen anyone been given a pill where within a few minutes they're free of their pneumonia or something like that. I haven't seen that yet. I've seen that with friends and acquaintances who've had this treatment, who changed dramatically within 24 hours, 4 hours, 48 hours. It all varies.